integral to that is the combination of public and private respiratory clinics. This Rosebud Clinic will be the 308th public clinic in Australia, and that's a mixture of state and territory and Commonwealth respiratory clinics. All are funded either in whole or in part by the Commonwealth, and together with the states, we're really pleased that these clinics have been able to provide support for Australians around the country. Testing allows us to identify cases and to find those people who might have been in contact with somebody that has been diagnosed. It's fundamental to saving lives and to protecting lives. What I do want to give is a brief update on containment and capacity before looking at the recovery process. In terms of containment, we continue to bring those people who are coming home to Australia into quarantine, and that is helping to save lives and prevent cases being spread through the community. It's been one of the most important things Australia has done, beginning with the ban on the 1st of February for non-Australian nationals coming from China. Secondly, we have our testing program, and shortly before coming here I've been informed that there have been almost 530,000 tests conducted in Australia now, and that's an exceptionally important development. In terms of contact tracing, which is the process of where somebody has been found to be coronavirus positive, they are then asked to identify those with whom they have been in contact. The states and territories have done a fantastic job on contact tracing. The app has now been added to that, and the advice I have is that as of 12:30 today, an extraordinary 2.44 million Australians have downloaded and registered for the COVID Safe app. Just to repeat, an extraordinary 2.44 million Australians have downloaded and registered for the COVID Safe app. In terms of our distancing measures, Australians continue to do an extraordinary job in what is a difficult situation. People have come together as a single Australian nation, as one single Australian family, and I want to thank them for their continued work. I know it's difficult, but you are saving lives and protecting lives. And the evidence of that is that there have been 12 cases identified in the 24 hours to 6:30 a.m. this morning. That includes the fact that most significantly, there was only one case from unknown sources. So only one case of community transmission across Australia. That is perhaps the most important figure I've had the privilege of raising since coming into this role and dealing with the coronavirus issue. It means that as a country, we are not just flattening the curve, but we are consolidating it, extending it, and securing it. So the flattening of the curve is being consolidated, extended, and secured. We have had now 100 cases in seven days, and there are 6,727 cases, as reported to me by the National Incident Centre, and 85 lives lost very, very sadly shortly before coming to you. In terms of our capacity, we now have, with regards to our support for primary care and hospitals and others, 75 million masks that have arrived in Australia. And I'm pleased to announce today 500,000 for the disability sector. So 500,000 masks for the disability sector, and I think that that is extremely important. Half will go to the primary health networks and half will go to the NDIA. Further than that, our aged care workers are doing an amazing job. They're saving lives and protecting lives and showing deep compassion every day. And in our hospitals, I am very pleased that our numbers have continued to drop. 111 hospital admissions for coronavirus at present, 43 in ICU, and 27 on ventilators. There were some predictions about 6 weeks ago that by the end of April we would have run out of ventilator capacity. I'm very pleased that not only was that incorrect, but they were incorrect by a factor of 300-fold almost, that we have 7,500 ventilators that are available for use in Australia. With regards to our recovery, I've mentioned what we're doing on tracing, 2.44 million downloads and registrations. Our rapid response capability is being stepped up around the country, and today we're expanding on our testing capability with the 308th Commonwealth or state clinic that's in operation, and very importantly, these are supplemented by private clinics, and there are over 40 private clinics from Seaford to Rosebud, as an example, who through their ordinary role as pathology centres are providing support to coronavirus testing. So altogether, what that says is that Australians are doing an extraordinary job. We are winning, but we have not won yet, but every day we are getting closer.